everyone, welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I have a very interesting topic to discuss with all of you. Now, we all know that constipation is a common problem in pediatric age, with prevalence often ranging up to 29% of normal frequency, and consistency of the stool varies with children's age as well as their diet. Now, there is also a considerable variation across children, that is, each child is definitely different. So, to give us more information about this interesting or this important topic, we have with us today Dr. Lavenya R Padmanaban, who is a consultant at Pediatric Gastroenterology and Hepatology. She has an experience of over 10 years in pediatrics and over 5 years of experience in pediatric gastroenterology and hepatology. She completed her MBBS from Coimbatore Medical College and MD Pediatrics from the Institute of Child Health and Hospital for Children, Madras Medical College. Subsequently, in the UK, she completed her MRCPCH and trained in pediatric gastroenterology and hepatology at King's College Hospital, NHS Trust in London. She has vast experience in managing children with common ailments and good expertise in managing children, especially with complicated gastrointestinal as well as liver disorders. We welcome you to Medical Dialogues, ma'am. We are really happy to have you on board here with us today.
Thank you so much, Doctor, for the warm welcome and the good introduction. I'd be quite pleased to discuss this I would say, forgotten or a topic that is considered as taboo by still many of them in the society. So I'm really looking forward to have a good discussion.
Great. Yes, ma'am. Definitely. This is an important topic. So just to give a start, if you can just tell us what are the various factors that can actually cause this pediatric constipation?
See, constipation in children is very, very common, as you mentioned. And we medically kind of categorize it into two broad categories. One is called functional constipation or habitual constipation, which is something to do only with our lifestyle. And the other category is what is called organic constipation, where there is actually a problem that is triggering or presenting as constipation. So there is some medical problem that needs to be identified and treated in addition to managing the constipation. Now, coming to functional, because that is the commonest problem in the community. More than 95% of our children who have constipation, it is just simple functional or habitual constipation. Now, the trigger factors, quite varied, depends on our lifestyle and dietary choices. Dietary choices in younger infants as well as in older children both matter equally. So in infants, like too much of milk guzzlers, abrupt transition of diet from breastfeeding to some formula or to solid-based diet without adequate fluids. Older children, lack of fiber in their diet, a lot of junk foods which has kind of become a norm for us, even though we don't realize how much of junk foods we're taking in. And the certain kind of beliefs about avoiding certain fruits, certain vegetables which are thought to be dangerous, not good for us, such things. Plus inadequate fluid intake, because that's a very common problem, especially in school going age. They forgetful, the bottle comes back exactly the same, hardly half the bottle is drunk. Factors. In addition to that, toilet habits right from infancy for the young children. There's no time in the morning, they're busy with whatever work they have, playtime they have, so postponing or hardly spending a minute in the toilet. So these are some of the factors. In addition to that, there are certain unexpected changes in our environment. Say a young child starting nursery, starting school, it can be a stressful factor for the child. Children who don't like to use the school toilet or toilets when traveling, and intercurrent infections these children get. The use of repeated use of certain medications, including our common cough syrups, pain medications. So there are factors that can trigger functional constipation. And coming to the organic constipation, where I said there is actually some other problem going on with the child, and you got to the constipation as well as the primary problem. So common things in children: milk allergy, we call cow's milk protein allergy or CMPA. Children who have gluten allergy in a genetically predisposed individual, what is called the celiac disease, and the other problems like thyroid issues, certain metabolic conditions. When a child has muscle weakness or nervous weakness, due to various reasons, spinal cord problems that affect the legs, that affect the bowel and bladder habits, conditions like Hirschsprung's disease, where there is a problem with the innervation of the large intestine, the nervous problems, where the problems onset quite early on in life when they are very small babies. And in some kind of rare scenarios, when, for example, the child is on a lot of pencil containing lead
Mm-hmm.
intoxication, you've got high environmental lead levels from the water.
Mm-hmm.
So these things can also cause.
So, coming to the two types we're talking about, what will be the diagnostic criteria for constipation in children, which is we are applying it to Indian practice settings per se?
See, that's a very good question because, in general, when do we call constipation? So, when there is a delay in passing stools, what
Mm-hmm.
medically is called, or when there is a difficulty for children to pass stools. Now, according to Western literature, they consider a child to be constipated if the child is passing less than 2 stools per week. So that means
Okay.
once in days. And
Mm-hmm.
of course, the parameters being the stool consistency, where the stools are hard, big lumps, or the
Mm-hmm.
child soiling their underclothes without their knowledge, that's called incontinence, or the stools are really big, kind of blocking the Western toilets, or the child has significant distress, pain in relation to passing stools. Now, in the Indian standards, all the other criteria, the stool consistency, the difficulty, pain, whether it's abdominal pain or pain at the bottom, the perianal pain associated with passing stools, leakage of stools called incontinence, all that applies. But if you look at the number of stools, generally the what we call oroanal transit time, like the time taken for food bolus or any substance to travel from our mouths to the anal canal, is faster for us compared to the Westerners. So, number of stools being less than 2 per week, that will lead to a significant underestimation of constipation in our children. I believe our children should be passing stool at least once a day. That should be the norm for all children. And of course, younger children, less than 4 years, they may pass 2 times or sometimes even 3 times a day. So, any reduction in the frequency of passage of stool compared to what was normal for them before is significant, as well as other parameters such as consistency, difficulty with passing stools should also be considered.
So, as you mentioned, we've had a talk about diagnostic criteria. So now, can lifestyle factors like diet during the infancy period or the feeding changes, that is, switch from breastfeeding to formula feeds, you also mentioned that is one of the major causes of constipation in children, or even the initiation of solid foods, all these factors together cumulatively can trigger constipation, right? So, apart from this, any other practical pointers relevant for lactation consultants or primary care physicians that you would want to add on here?
See, lactation consultants, the main thing is, as pediatricians, as we say, definitely encourage them to continue exclusive breastfeeding till the age of 6 months. That really helps the child long term, not just in the context of constipation, but many other allergy and gut related long term health issues. So that's really important. Of course, if there's no other choice, yes, they need formula, they need it. But
Mm-hmm.
I think general, kind of the idea of using formula as a supplement can be discouraged wherever possible. So that is my sincere advice to lactation consultant. Number two, sometimes we do advise, like after evaluation, doctors do advise mothers to have some dietary changes, like exclusion of milk products in their own diet for the
Mm-hmm.
benefit of the. So those things must be evaluated by the doctors and advised rather than blindly following unnecessary dietary restrictions. So that also needs to be taken care of, because it's not uncommon in our society that mothers have, young mothers, lactating mothers have a lot of unnecessary dietary restrictions, which actually affects the balanced nutrition for the child also. So that has to be discussed when they meet them. And in general, for the primary care physicians, I would say encourage the parents to actually monitor, discuss about bowel habits with the children. Because in this busy life of us, we don't have the time or intention to look at what is happening with their toilet habits, because we, as far as we know, the child is fine, the child is going to pass stool every day. But actually, only when they come to us with some issues like a tummy pain, then we start looking. So I always advise my patients, my parents, to go back at least few days, monitor what is happening, so we have a better understanding of what's happening with the child. And rather than waiting for problems to emerge and managing it, it would be nice to prevent such problems, which is basically simple: maintaining a healthy lifestyle, healthy nutrition, adequate fluid intake, a regular toilet routine. So these are some of the good habits. If they develop as children, I'm sure it'll stick with them lifelong and is going to benefit them a lot. So these are things that can be discussed and encouraged by the primary care physicians. And other most important thing is, if you see a child who already has got into trouble, who needs medical care, yes, support them, treat them adequately. And I'm sure there'll be concerns from parents about how long to give medicines, is it safe? We got to address them effectively, make them understand, so that they don't stop treatment abruptly.
Very true, ma'am. So, coming to the management part of it, now that we've discussed the diagnostic criteria, the factors affecting it, so what is the management approach in treating constipation in children?
So management, I always tell my parents, starts with lifestyle, which is your dietary factors, fluid intake, a regular toilet routine, and in physical exercise. Nowadays, I hear grade 3 and grade 4 children telling me, I don't have time for play because I've got homework, I've got tuition, I've got some other work. So we're kind of getting used to this unhealthy lifestyle. So that is also something we got to talk about, encourage them to have a normal childhood, and of course medicines. So we've already spoken about diet and fluid intake. Now, when I say in children who are toilet trained, at least twice a day, encourage them to use the toilet because they don't find time for it, or they don't want to waste their time in the toilet. So parents have to make it a point to remind them, to tell them to go and use the washroom twice a day for 5 to 10 minutes each time. That gives a healthy routine. And encourage the children, teach the children not to hold urine or stool when they get the urge. Because many children don't use the school toilet, or they don't have time to go and wait in a queue in the school toilets. So that is something that has to change slowly. And coming to medications, it's really important when you see your child is struggling, has got some problem, meet your doctor, your pediatrician, or a pediatric gastroenterologist. Discuss with them, and whatever is the advice, please follow them appropriately. Because it's very common that I see they give the medications that are prescribed, and once the child feels better in few days, abruptly medications are stopped, or they don't turn up for follow-up because the child is fine. Now, treatment in chronic functional constipation. When I say chronic, it means the symptoms have gone on for more than 4 weeks. So most of the time, these children need medications once a day, what we call the maintenance medications, for good few weeks to few months. So that is decided on an individual case basis by the treating. Don't abruptly stop medications. Don't self-medicate as and when required. Don't get over-the-counter medicines for children.
So, coming to the next part of the discussion, now we know that gut dysbiosis is a powerfully emerging concept in the global scientific community. So, does this have an interaction with the development of pediatric constipation among toddlers or even older children for that matter?
Yes, and see, gut dysbiosis, as you said, it's a very well-known concept now, and more scientific research is going on about how the gut microbiome influences many functions of the body, many conditions that the face and adults face, including this gut-liver axis, this gut-brain axis. So there are a number of conditions that are linked to the health of the gut microbiome. So what is gut microbiome? It is just the billions of bacteria that we all carry in our intestines and the gastrointestinal tract. This is normal for us, but the kind of varieties of the bacteria that we carry is quite variable from one individual to another. And there can be genetic patterns because very commonly we hear in clinics. So I also have constipation, the parent, the grandparents. So is it genetic, doctor? So constipation is never genetic condition, but the kind of lifestyle in the family is probably the same. Plus,
Mhm.
kind of gut microbiome they carry might be the same. So there are certain species of bacteria which are considered as beneficial for us. There are certain which are considered as not so beneficial or harmful for us. And there needs to be a balance in this gut microbiome that we are all carrying. Now, this balance can easily get disrupted, changed based on the kind of food we eat, the kind of medicines we take, including the antibiotics,
Mhm.
because it all depends on what we are consuming. So there are a number of studies to and talk about how to maintain healthy gut microbiome. So some of the simple things that we can definitely do on a daily basis, rather than like how our ancestors followed a healthy lifestyle without actually having not studied this gut microbiome, is follow simple healthy eating habits, like include more of fiber in your diet, vegetables, fruits, definitely legumes, whole grain cereals, and fermented substances like yogurt. So they provide you with vitamins, minerals, fiber, probiotics, prebiotics, which help nurture your healthy bacteria in the gut. So, as long as we change or rather follow a simple healthy lifestyle, our gut microbiome will be healthy. Now, how does this unhealthy gut microbiome affect our body? Now, there are studies to say that it can even influence chronic inflammatory conditions in the body, including inflammatory bowel disease. So,
Mhm.
gut microbiome is important or plays a role in the secretions that are being produced in the intestine, the way the intestine moves, the motility of the intestine. So, it's not just digestion, there are other factors also which play a role. So, let's keep our gut microbiome very healthy.
If we're still talking about the management aspect of it. If constipation, if it is not treated sooner, what impact can this condition have on the child's physical and even the mental well-being?
See, constipation is a simple medical problem, very easily manageable, treatable. But unfortunately, most of the time it is ignored or rather not even recognized constipation. So it's very common that I hear from parents, how long has the child been constipated? So it's normal for the child to go motion once in 3 days, which is not normal according to me. And the long term impact of untreated or undertreated constipation, first, let's look at the physical factors. A lot of physical complaints like pain. So, pain is something these children get used to. Abdominal pain, it is there, it is mild, it comes, it goes. It doesn't really affect their lifestyle. So, it's not, actually being given that much attention, but they're used to the pain. Some children, they come to middle of the night to us because of severe pain when they pass stools at the bottom called perianal pain, sometimes blood stool because they've been repeatedly straining, and some of the children even have urinary symptoms. They find it difficult to pass urine, repeated urinary infections because the bowel and bladder habits are very closely associated.
Hmm.
The psychological impact on these children is really huge. They just stand in a corner of the room, they hide when they want to pass stools. Parents think that they're actually straining to pass stool, but actually they're trying their best not to pass stools. And they find it really difficult to engage in toilet training because in their minds, it is a very painful process which obviously they do not want to go through. In older children, there is a lot of fear about using toilets. They postpone as much as possible because it's again a painful process. And I see even much older children coming to me with stool leakage involuntarily. So the parent obviously is quite worried and they think they're doing it voluntarily, but that's not true. This child has been suffering for a long time. Social anxiety, the fear that they will have to use the washroom in between, the fear that stool might leak when they're going to play. So these things are, they're not very common, but I do see such children now and then. It's very unfortunate. Social anxiety, school phobia, missing out on school, and their healthy regular lifestyle. So these are some of the things that I very commonly see in such children, because as I said, it's a simple problem but often becomes chronic or recurrent. So it not only affects the child's lifestyle and mental physical health, which affects the peace of mind of the entire family. So I think it's something that is preventable, that is easily treatable. So please don't ignore.
So, coming to the end of our discussion today, ma'am, if you could just highlight on what are the red flags of pediatric constipation that a primary care physician that may need to be aware of for timely referral or for the patient.
Sure. See, as I said to begin with, 95% of the time constipation is functional in children. But it doesn't mean they do not need a referral to a specialist. Why? I'll tell you. Many times they don't respond to treatment adequately, or the underlying lifestyle factors are not effectively addressed. So there is ongoing problem, or once they stop the medications, it's very common parents come back and say, we stopped the medicine last week, again this week he's got the same problem. So how long is the child going to need medicines? So these are questions that have to be really effectively addressed. I consider this itself as a red flag needing referral so that they can be effectively educated and treated appropriately. Any child who is not responding to your medical management, adequate doses of laxatives, please send them to a specialist, let them get evaluated. Any child where you find any other symptoms like child is not growing well, child has anemia, child has some other findings that make you worry, so please send them immediately. It may be constipation with an underlying problem like celiac disease, or it may be constipation with an unrelated problem also. And any child who has developmental delay, who has muscle weakness or nervous problems, these children are bound to have refractory constipation, difficult to treat constipation, so please refer them early. Any child you suspect to have problems with for example, with delayed motor milestones, not walking, running at the appropriate age, child has both bowel and bladder problems, please refer them early. I see children with constipation as well as they have bedwetting problems, they have urine leakage in the daytime. These children need definitely further evaluation and management appropriately. So such children, please refer them early. Any infant where you see constipation onset before the weaning period, from very early on. Sometimes there is good classical history of delayed passage of the first baby stool called meconium. Sometimes you don't get the history, but you will hear from parents that from the first week, second week, this baby has been struggling, baby has needed rectal stimulation, baby has needed some medicines through the bottom. So these kind of history, if you get, please refer them early. It could be something to do with organic constipation.
Thank you so much. Thank you for coming to Medical Dialogues today.
Thank you. Thank you so much, Dr. Nandita. It was a pleasure interacting with you. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.